Good evening and thank you for joining us. I'm Catalina Gillies. The Transportation Safety Board has completed its on-site investigation of the fatal plane crash at the Thunder Bay Airport, and the burnout wreckage was scheduled to be removed from the tarmac by tonight. A crane and other equipment arrived on scene late this afternoon. The lone occupant, the pilot, was killed when the small plane crashed soon after takeoff. According to the TSB, the aircraft was found in an inverted position and was destroyed by a post-impact fire. A preliminary inspection of the flight controls has not revealed any pre-impact abnormalities, and no evidence of bird ingestion was found. The site will now be released, and the aircraft wreckage will be stored in a secure location for further examination. Investigators will also continue to conduct witness interviews and gather information from company officials and air traffic control. Nearly all flights were running on schedule at the airport today. The Thunder Bay District Health Unit is reporting 3 new cases of COVID-19 today. All 3 are located in the Thunder Bay and surrounding area. The health unit has determined that 2 of the cases are due to close contact, while the other one was related to travel outside of northwestern Ontario. The active case count for the district is now up to 5, and the total cases since the pandemic began is 3,353. Meanwhile, the health unit has announced that planning has begun for 3rd doses of the vaccine for the most vulnerable populations. They include certain high-risk patients and people in seniors' homes and elders' lodges. Further details will be provided soon. And starting today, any children born in 2009 can get the vaccine, even if they're still 11 years old. Ontario is seeing another spike in new COVID infections. Another 485 have been reported today, though it's unclear how many of those infections are among vaccinated people. Still, the movement toward mandatory vaccination is growing in the province, including within the Ontario's Conservative Party. Colin DeMello reports.
For the better part of August, frontline staff at the University Health Network have been working under new rules. Either get vaccinated or get tested for COVID-19 on a regular basis.
With it, I'm happy to say we've seen a really fantastic uptake of vaccination, and we're now between 92 and 94% of people at UHN who are vaccinated, and about 8% of people who we're working with on the swabbing program.
The Ford government is now applying those rules to the entire healthcare and education sectors. Staff will have to prove their vaccination status, and the unvaccinated will have to undergo regular testing. The goal is to increase vaccine uptake, especially with those interacting with students and patients.
Is that far enough? So we frankly are going back to say, are there places or in UHN or all of UHN, because of what an acute environment it is, that we have to insist that people actually participate in a vaccine program or think about taking a leave of absence? So we're just in that process.
But education workers say the Ford government missed the mark with its vaccination policies. The Elementary Teachers Federation of Ontario, a union representing 83,000 education workers, voted in favor of a mandatory vaccination policy.
The plans of the Ford government didn't go far enough in regards to the measures that need to be put in place. They've left it for individual boards to look at those issues, and that's unfortunate.
While Premier Doug Ford has repeatedly rejected the idea of mandatory vaccines for healthcare and education workers, the Progressive Conservative Party seems to have a different set of rules for its own members. The government is threatening to eject 2 Progressive Conservative MPPs who have yet to be vaccinated, giving them until Thursday at 5 p.m. to prove that they've had a shot.
This was the right thing to do. To require those MPPs in the Conservative caucus to get their vaccinations, absolutely. But we still have have some work to do around education workers and healthcare workers who also should be mandated to have their vaccines.
PC Party insiders say the Premier's office initially called MPPs, asking them not to disclose their vaccine status to journalists.
Thunder Bay union officials are reacting to the Ford government's new vaccination policies announced yesterday. As mentioned, the changes affect all employees working in healthcare settings and the education sector. Mitchell Ringos reports.
It's a step in the right direction. Is it far enough? I think we could go further.
Teachers and school staff are among those impacted by the new rules put in place, which require proof of vaccination starting by September 7th, with all workers who don't have the vaccination to get rapid tests at least once a week. Provincial Medical Officer Dr. Kieran Moore says these tests could be done twice or 3 times a week depending on how the Delta variant spreads in the community. President for Lakehead Elementary Teachers of Ontario, Mike Judge, says how he believes the mandate should be handled.
We as an organization have put forward a resolution to mandate it with, of course, room for exceptions. We'd like to see everybody vaccinated. I think the Chief Medical Officer of Health's on the record saying this is the best way to curb the pandemic and keep people safe. And I've been on the record from the start saying, let's listen to the experts here.
Unifor Director of Healthcare Andy Savella represents many of the healthcare workers affected by the new rules. He says he wished the government would have came to the union for advice before the decision. The government has put forward a suggestion that employers can go above and beyond the policies in their workplace to enforce vaccinations, but Savella says it's a problematic way to go about the situation.
We've been getting calls from workers in all public sector front-facing workers who really now are stuck with the chore of trying to debate the policy in their individual workplace. And the problem is the government said they'll support these employers, but how do we adjudicate all this? I mean, it's really quite impossible.
Mitchell Ringos, TBT News.
The rehabilitation of the Boulevard Lake Dam is set to exceed its tendered cost by $1.5 million, according to new reports from the City of Thunder Bay. The extra costs are chalked up to worse than expected wear on post tensioning and other elements of the dam, removal of bedrock and unexpected cold weather and heritage work. That raises the total price tag to around $8.7 million, which is still well below the city's pre-tender estimate of $12 million for the work. The project is being carried out by local contractor Concrete Walls, with Ottawa funding 40% of the total price tag. The additional costs will come before City Council for approval on Monday night, with administration proposing the amount be drawn from a capital carry forward budget. Public access to the interior of Quetico Provincial Park is now being restricted. An announcement posted to the social media pages for the Wilderness Park says the backcountry is closed to all travel and camping. However, the Dawson Trail campground is still open. The message pointed to increased forest fire activity and the impact of smoke. According to information posted online by the MNRF's firefighting agency, 9 blazes are burning in the south-central portion of Quetico. The forest fire hazard is extreme in the western half of the park and high in the eastern half. Meanwhile, the province reported no new fires in the northwest region on Tuesday. However, there are still 100 active fires, including 11 that are not under control. The damage from the tornadoes that hit Barrie, Ontario, and 5 other areas July 15th has been estimated at a whopping $75 million. The figure comes from a company associated with the Insurance Bureau of Canada and represents insured damage. The tornadoes left 71 homes uninhabitable and resulted in more than 2,200 insurance claims from both residential and commercial property owners. Health authorities are warning Thunder Bay area residents about a steep increase in the risk of Lyme disease from back-legged ticks this summer. Ian Kaufman has the details.
Nearly 63% of black-legged ticks collected through active tracking by the Thunder Bay District Health Unit this year have tested positive for the Lyme disease bacteria. While that's based on just 8 tick finds, vector-borne disease coordinator Ken Beacon says the results represent a worrying jump from previous years.
Oh, I was shocked. We've run maybe a high of 10% of the ticks through the course of the season being positive for Lyme disease, but to have 62.5% of the ticks testing positive, that was pretty startling.
All of the finds were from Rabbit Mountain, which Deacon called a local tick hotspot. The health unit urges the public to avoid long grasses and overgrown areas, wear pants tucked into socks, and do a thorough tick check after time outdoors. Those are precautions local residents may have to get used to. The prevalence of ticks is likely to increase due to climate change, said Deacon.
The winters have become increasingly mild, and it's the winter temperature that kills the ticks. So as the climate changes, it means that you're going to see more ticks established in more locations. And it's one of those unfortunate consequences of climate change.
Black-legged ticks remain rare in the Thunder Bay area, Deacon said. Most local ticks are wood ticks, which don't transmit Lyme disease. Residents who find a tick on themselves or their pet can submit it for identification here at the health unit's Balmoral Street headquarters. Ian Kaufman, TBT News.
New parking pay machines have now been installed on several streets on the city's north side. They're meant to make it easier to pay for parking while deterring theft with the more secure multi-space kiosks. Finding change to feed the meter will be a thing of the past for part of Thunder Bay's North Core. New digital parking machines are now in place for one block of Cumberland Street and St. Paul Street between Red River Road and Van Norman Street. The 4 pay machines are the same kind the city has been using in its surface lots for years and can each cover 20 spaces. Parking Authority Supervisor Jonathan Paskey explains the new parking process.
You park your car, you head down to the closest machine in the direction that you're headed. You enter your license plate, so please be sure you know your license plate before going to the machine. Enter the license plate, the length of time you'd like to park for. Make your payment either with coins, credit card, or a meter card.
Similar pay machines on Van Norman and Park Streets will be up and running in September when the city unveils angled parking on the 2 roadways. Paying through a mobile phone app will also be available in the next couple of months.